I see you counting in your head.
Hippopotamus too. Audio check. 1, 2, 3. We are delighted this evening to have two trailblazers in the field of dental health with us, Dr. Nicole Cheek and Dr. Hazel Harper. My name is Kit Dulin, and I am the core volunteer coordinator working with our leadership program here at Remote Area Medical, and I'm delighted to be your moderator this evening. I want to tell you a little bit about these wonderful dentists that we have with us today. First, Dr. Nicole Cheek graduated from the prestigious Howard University College of Dentistry in 2014. She earned her undergraduate degree in biology from Howard as well. As an undergraduate, she was a student member of the Diamante Driver Dental Project, for which she received a gubernatorial commendation from the governor of the state of Maryland. Dr. Cheek has a strong passion for serving the community. Her passion for community service has naturally led her to join NDA Health Now, the signature program of the National Dental Association. As the Special Projects Assistant for NDA Health Now, Dr. Cheek worked to conduct community outreach events and support events all over the U.S. and in many countries. Most recently, Dr. Cheek coordinated a collaboration between a group of dentist volunteers, Howard University students, and a school in Washington, D.C. to bring NDA Health Now Passport to Total Health program to their elementary students. Dr. Cheek practices general dentistry full-time in the Washington, D.C. area and continues to volunteer on the NDA Health Now project. Dr. Cheek has received several awards and recognitions, including the NDA Presidential Special Recognition Award, Colgate New Dentist Leadership Award, NDA 40 Under 40 Award, and the NDA Women's Health Symposium Trailblazer Award. Dr. Cheek received a proclamation of honor and recognition from State Representative Delisha Boyd in 2023 and is a graduate of the ADA Institute for Diversity and Leadership program. She has also served on the executive committee for the Robert T. Freeman Dental Society and the Howard University College of Dentistry Alumni Association. Dr. Cheek maintains memberships in the Jamaica Dental Association and the Links Incorporated. Presently, Dr. Cheek serves as the 100th president of the National Dental Association. So welcome, Dr. Cheek.
Thank you, Kit.
Welcome, Dr. Hazel Harper as well. Dr. Harper is a graduate of Howard University College of Dentistry and the Johns Hopkins University School of Hygiene and Public Health. She maintains a part-time private practice in general dentistry in Washington, D.C., and she is the president and CEO of Hazel J. Harper Associates, LLC Management Consultants. A woman of many firsts, Dr. Harper was the first woman to serve as president of the National Dental Association, chairman of the NDA Board of Trustees, and the president of the Howard University College of Dentistry Alumni Association. She was one of the founders of the Student National Dental Association, longtime editor of the National Dental Association Journal, and created many NDA programs, including Women's Health Symposium, NDA Corporate Roundtable, and the Eddie G. Smith Leadership Institute. She co-founded and directed the Diamante Driver Dental Project, a school-based mobile dental project in Prince George's County, Maryland, named in memory of the 12-year-old boy who died in 2007 from untreated tooth decay. She is currently the founding director of the award-winning NDA Health Now project and the architect of the Interprofessional Student Leaders Colloquium and Summit. And she currently serves on the board of directors of the American Dental Education Association Geist Foundation and Remote Area Medical. Welcome, Dr. Hazel Harper. Thank you both so much. It's such an honor to have you here. Audience, a quick reminder, please remain muted. If you have any questions, you can put them in the Q&A box if you're on Teams or the chat in YouTube. So let's get started. If you want to take a few minutes, both Dr. Harper and Dr. Cheek, and just tell us a little bit about yourselves.
Okay, well, thank you so much, Kit. As you said, I'm Dr. Nicole Cheek, and I do have the honor of serving as the president of the National Dental Association this year. And a little bit about me, I got into dentistry. I did not always want to be a dentist. I was actually pre-med. And I started working for my brother, who's a dentist, the first dentist in our family. And initially, I didn't even want to do that. I didn't want to work in a dental office at all. But once I started working in dentistry, I found I really couldn't stop. I developed an absolute love for it, I always wanted to help people. That's why I was pre-med. But dentistry really just, it allows you to help people in a way that's so immediate and so profound, and you really touch people's lives and change their lives. So I really got sucked in. It was while working at the dental office that I joined the National Dental Assistants Association as a at my boss's best. And from there, I went to dental school. I was a member of the Student National Dental Association, and then upon graduating, became a member of NDA. And also, as I graduated, I started working with the NDA Health Now program, as you said, and from there began working with the leadership of the National Dental Association. RAM, this is Ram's first webinar, and I'm so honored to be here for it. Thank you for having me. We got involved with RAM. I actually was with Dr. Harper. We were at a dental convention, and she started talking about this group, and she said, oh, they're doing these wonderful things, and oh, it's so amazing. And I'm like, who is she talking about? Well, got to know who RAM was, and I'm so proud of the partnership that RAM and the National Dental Association have established. We've really been able to do what it is that we already do. We volunteer, we go out into communities, we help people in need. That's who the National Dental Association is. And we came to find out that that's who RAM is too. So it's been a perfect fit from the beginning, and I am absolutely continuing to love everything that we do together. I think I'll stop there. I think I'll let Dr. Harper go ahead. There are, a lot of things that I want to say, but I know we don't have all night. So I will pause for now, but I have so much more to say about NDA and about RAM. Dr.
Thank
Harper.
you so much, Dr. Cheek. Dr. Harper, tell us about yourself.
Well, I started out going to pre-med also. My father was a physician. My mother was a nurse. I am first generation immigrant from immigrant parents that came from Guyana in South America. And it was at the engagement of my stepmother that she asked me to speak to one of her college sisters, a sorority sister named Dr. Jean Sinkford, who is the past dean of Howard University, the first female dean, to just go talk to her about dentistry. She knew I was always interested in working with my hands. I did. And the rest is basically history. And while there, I had very powerful mentors while I was in dental school. One was Dr. Stinkford, the other was Dr. Joseph Henry. And at the time, there was not an organization for African American dental students. And there was a group of us that really wanted to make sure that changed. And we had the complete encouragement and support of Dr. Joseph Henry and all of the faculty members that were there at Howard. So a lot of my mentors were the ones that really propelled me into being in organized dentistry, helping to start, along with other students across the country, helping to start the Student National Dental Foundation, Dental Association, and then to transition into the National Dental Association. And it was also my mentors and my peers that encouraged me to run for office, to become the first woman president of the National Dental Association. And as Dr. Cheek has said, I think that our commitment to service started with Howard University, and I don't think that ever left. I was honored to be able to be moderating a session at the Greater New York Dental Meeting where I met a gentleman named Chris Hall, who was one of the presenters on the program. And when he gave the story about the background of RAM and how Stan Brock started this program because he had lived and experienced a real health crisis in Guyana, I perked up immediately because my roots are in Guyana. I became fascinated with the story. And after the session, I invited Chris Hall and another lady that was there, Mary, come have coffee with me. Could we talk some more about it? And the rest is really history. I knew that RAM was an organization where I belonged, We share the same mission. We have the same purpose. And I'm looking forward to a long, long partnership and to growing our collaboration in many areas. So I'm delighted to be here.
Well, thank you both so much for sharing that. It's wonderful to hear how you came into the field of dentistry and also just the passion for community service and how that aligns with RAM. That's wonderful. Thank you so much. So as we are talking about things like disparities within healthcare that RAM focuses on so much, one of the things that we obviously want to talk about tonight was dental health for children and some of the disparities that people face. Kind of leading into the discussion about this, I think it's an estimated about 30 million children right now that don't have preventative medical or dental care, roughly the population of Texas, in one of the wealthiest countries in the world, the United States. Can you talk a little bit about how does this lack of preventative dental care directly impact children? Whoever wants to go first.
Well, I think most directly, it's easy to see how a lack of preventive dental care leads to a higher incidence of caries, dental decay, and dental disease. And so then when that's happening, we're talking about more than 40% of children by kindergarten being affected by dental decay or cavities. And cavities may seem small, it may not seem like, it's not a big deal, it's just a little hole in a tooth. But if it's not treated, it can lead to teeth being infected. That can lead to pain. It can lead to lost school time and just the suffering of the children. Mm-hmm. And then not only that, but also sometimes we don't always think about the fact that if we're having issues with our teeth, the very necessary act of chewing our food can also be impacted, and that can impact your gastrointestinal system all the way down and also lead to nutritional deficiencies because that is part of the digestive process. So those are just some of the ways. And then not only that, but we can never negate the importance of a smile. Absolutely. Of just being able to smile. Children can be so mean. They can be so cruel to each other over the smallest things. And so definitely teeth that are, not nice to look at or maybe even missing can definitely be a source of a confidence issue for children, which of course makes it more difficult just for them to go about their day. But those are just some of the things.
Absolutely. Dr. Harper, anything you want to add to that?
Well, I just think in the most extreme case, to just piggyback onto everything that Dr. Nicole has said, was when I realized in reading in the newspaper that a little 12-year-old boy named Diamante Driver had died from untreated tooth decay. And I couldn't believe what I was reading. I found out about it like everyone else, and it just didn't seem possible that this could happen in the United States. So as I dug a little bit deeper, as I do, and I wanted to find out, I heard that he lived in my county, in Prince George's County, Maryland. And I wanted to find out, well, where did he live? Where did he go to school? Was he anywhere near where I am? So I found out that the little boy's school was 5 minutes from my house. I didn't even know a school was there. Goodness, yeah. And when I found that out, it was like a dagger going through me. And I said, I just feel like I have to do something. I need to do something. I found out that the lady that was working with Diamante's mother had tried to help them find dental care, actually for his brother. And they weren't able to find any dentist that would see him. They called 30 dentists, and all 30 said no. And they may not actually have ever spoken to the dentist themselves, speaking to the receptionist who answers the phone if they saw that the child did not have insurance and the child did not have dental insurance, which brings us to some of the reasons why there's so many children that are left out of the system, that are falling through that safety net, and through no fault of their own. His mother was homeless for a while, and her Medicaid had lapsed. She had wanted to have coverage, health coverage, and dental coverage for her children, for her sons, but she didn't at that time. I found out, like everyone else found out, that the little child had died from infection, sepsis of the brain, where he stayed in the hospital, had 2 surgeries, and they couldn't save him. And it was then, I think, that my life changed, and I realized that there had to be something more that we could do. And that's when I think I became very, very immersed, more immersed in community service and community outreach. And I'm still there. I'm still realizing every day that the death from untreated tooth decay or dental disease did not stop with the Amante driver, that there's still children and there's still adults that are dying from untreated tooth decay because they're left out. So whatever we can do, however we can prevent that from happening is something I think we all need to be aware of. And I really do think that prevention is the key to be able to help children grow up to be adults who really understand and know that they can control tooth decay, which is preventable, gum disease, which is preventable. But most of the time, the children don't know, and the grown-ups that they're attached to, they don't know that those 2 diseases are transmissible and treatable. So I think a lot of what we need to do is continue to seek out to care for those children that have been left behind, but to also push messages of prevention in hopes that something will stick with them. So as they're growing up, they have the ability to know that their tooth decay and gum disease are treatable, preventable, and treatable.
Can you share with us what the current recommendation is in terms of when parents need to start thinking about taking their children? Because I think lots of times people think, oh, these are baby teeth, they're going to fall out, and there's that idea. Can you share with us a little bit about what the recommended guidelines are?
Absolutely happy to. I mean, you're absolutely right, Kit. That definitely can be exactly the thought. These are primary teeth or baby teeth. They're not the permanent teeth. So, it can be okay. The recommendation is that the child sees the dentist at the eruption of the first tooth or at 1 year, whichever one comes first. And it's supremely important for more than just one reason. It's more than just evaluating the teeth as they erupt. If we don't have teeth by 12 months old, there may be some issues that are preventing tooth eruption, first of all. Second of all, the more that a child can be in a dental office, the more comfortable they are being in a dental office. We see so many patients, and I know that the same is for Dr. Harper. They are deathly afraid. Dental phobia is real, and it prevents people from coming in to seek treatment that they really need, or to get the preventive care that would make it so that they don't need treatment, restorative things, having things removed, having things replaced. So just becoming comfortable with being in a dental chair, with having someone go in your mouth and having a fun experience while you're there, it can be the difference maker over a lifetime between people who will access care that is available to them versus people who may have care that is available but aren't able to push through that fear in order to get the treatment that they need.
Absolutely. Absolutely.
If I could just say one thing, and I'm so
yes, please.
glad, Dr. Nicole, that you touched on that, because, as I was saying before, the children are connected to grown-ups. And sometimes it's the parents that are transmitting their fear onto the child. And the child maybe has never had a bad experience. And this day and age, our dentists know about how to treat a child to make it a fun and enjoyable experience, and to try to get that child in as soon as possible so that they don't have to have an emergency procedure done. We shouldn't be trying to see these children and babies when they come in with tooth decay that's totally rampant and teeth that have to be extracted. So I think it's equally important for us to try to educate the grown-ups that are attached to those children about not to relate their own fears or their own past terrible experiences. And I'm always sorry that people have had terrible experiences, but that doesn't mean that your child is going to go through that, So I think it's really, really important to understand that unless the parents feel comfortable and understand the need for prevention and the need for the child to be able to see the dentist on a regular basis, then it's going to be impossible for the little child to come to the dentist themselves without coming with their parents.
Absolutely. Thank you.
And I'm so sorry, Kit. And I know you have more questions. I know we have more things to cover, but as Dr. Harper was talking, she triggered one more thing for me as well. I think a lot of times for us, two people who had healthcare providers as parents, my parents are both physicians as well, and people who did go to professional school and have doctorates. And I'm thinking perhaps maybe a lot of the people that are watching this webinar today, understanding the need that is out there, because that wasn't our experience growing up, can be very difficult. And so then also just wanted to talk for a moment about those children coming to the dentist early. And one of the things Dr. Harper hit the nail on the head, they are attached to parents. And some of the things that need to be learned are nutritional counseling. Some of the things that need to be learned are oral hygiene. How do we take care of our teeth? Why is brushing important? Why on earth do I need to floss? What is this fluoride thing about? I heard it's dangerous. I don't even know if I should even be having that, be exposing my child to that or exposing myself to that. So having those opportunities to give education is a whole other reason beyond the actual physical care that we need those children in the dental office.
Wonderful.
And as she speaks about that, it's hard sometimes to counteract and to put out the real factual evidence-based, science-based information when some people are getting all of the wrong information from social media, and they think that everything they're reading is true. So then it really becomes one of the obligations of a health provider to be able to give that kind of information and factual information. And sometimes you strongly have to disagree with what someone may have read or someone may have heard. And also that goes to just in some cultures, how you have to be extra sensitive about letting mothers know that it's not the best thing to chew up food and put it in the infant's or the toddler's mouth. That's not the best thing. A lot of families and a lot of folks in different cultures, they don't realize that if the parents have gum disease or tooth decay, it's very readily transmitted to the children. So it's all about education and promoting prevention.
Thank you. That's wonderful. One of the things I do want to mention also for our folks who are online, be sure if you've got questions, you can put them in the chat. You can put them in the Q&A box if you're on Teams, or in the chat box in YouTube, and we'll try and get to those questions. But thank you so much. I love the answers there and the way that it broadened in terms of not just thinking about, the child, but also holistically looking at the family and how that has an impact. You mentioned several times talking about the dentists and the pediatric dentists. If you're a future pediatric dentist, can you tell me, what would be the importance of coming to a RAM clinic and seeing some of the possible health effects of young children that have not had adequate care? And how important is that for future pediatric dentists to sort of encounter that and see that and understand how to work in that type of setting? Can y'all share a little bit about that?
I'm sure I will. As you were speaking, I was thinking about some of my textbooks and seeing for the first time the term rampant caries, and they have a picture of what this looks like, and seeing a picture of baby bottle caries or baby bottle decay, and understanding just how devastating that is. And so for our folks who are going to specialize in pediatric dentistry, I think being able to understand not only is that a possibility, it happens so much more than you think. And I think that's one of the things when you go to a RAM clinic, obviously there is someone somewhere who suffered from this condition. There's a picture of it in our textbook. So someone somewhere, yes, it's happened, but it happens so much. It happens so much, Kit. There's so many people that are walking around suffering. And I think the vastness of the need is something that if you're going to care for people, you need to understand just how much need is out there. And so it's not just the individuals that walk into your office that you treat one-on-one. There is a huge need in our society. There's a huge need in our country. There's a huge need in the world. So I think just being able to begin to comprehend just how great that need is something that you cannot deny when you come to a RAM outreach.
Mm-hmm. And to piggyback again on what you just said, the people that are able, have the ability, the resources, the transportation, the opportunity to come into dental practices, whether it's the private practices or the community health clinics, the federally qualified health centers, they are in need, but most of the people that have the greatest need never make it into a dental office. They're the ones that are in rural America where they may not have a dental facility for miles or hours they have to drive to get away. And sometimes there's the situation where just the fact that the dental office hours are not extended or during the parent's work day, and they cannot take off to come or take the child to the office. That's why school-based care, place-based care is so important. And that's also why, as we're speaking, school nurses play such a valuable role, because if someone, and I go back to Diamante, if anyone, if a school nurse had been able to examine his mouth or see what was going on, he may not have gone that long without the care that he really needed. So dental professionals need help, and we need help coming from nurses. We need help coming from physicians, from OBGYNs that are in a perfect position to be able to explain the importance of prenatal care, dental care to expectant mothers. And they're really the best population to start learning about the importance of oral care for their children. They're really in the best situation, but it's very, very unfortunate that with regards to prenatal dental care, we have less than 30% of women across the country that are really getting prenatal dental care. It is safe and it's encouraged. So I don't want to go off on that tangent, but I do want to say that we definitely need some help. The dental professionals can't do it all.
And obviously RAM tries to stand in the gap to try and help, but just looking at it from a broader perspective, it sounds like a lot of collaboration is needed. But what other steps do you feel like we can take to kind of get this rolling? It's such a huge problem. Again, outside of a RAM clinic, what can we do?
Well, one of the things that's very important to the National Dental Association is the issue of access to care. And I remember the first time I heard that term, I didn't really know exactly what it meant. I've learned a lot of things working in dentistry. And so increasing access to care is absolutely what we must do. It's so funny. I've heard twice, once from a dentist and once from RAM, saying, what we really want to do is work ourselves out of a job. And so for RAM, they come and it's a rescue mission. It really is. It's a rescue mission. But what we really need to be able to do is provide access to care for all of, not only the children in this country, but for all of the people in this country.
Absolutely.
And so when you're talking about something like that, and especially in a year like this, where it's a very politically charged year, we have to acknowledge that the people who make our policies need to know what's going on with the people that they're supposed to be serving. And they need to care about the people that they're supposed to be serving. I remember I was watching Michelle Obama talk once, and she was saying, people say, oh, I don't want to get involved in politics. I don't like politics. And she said, politics dictates almost every aspect of our lives living in this country. And so you can't help but be involved in politics. So having policies that are set that support people having access to care is just that will definitely be playing a huge role in helping to solve the problem.
And I also love the way that RAM is very, very open to collaboration. And you have to be, all of us have to be very, very open to collaboration, because when you're able to attract volunteers that come from various communities, they know their communities. Now, a lot of the volunteers may or may not have ever gone into the kinds of communities or regions and seen the level of poverty sometimes, or the level of need that RAM really focuses on. And what I love most about RAM is that you seek out areas where you know there is the greatest need. And we touched on it a while back about how pediatric dentists, and I'm going to say pediatric dentists and all healthcare providers can really benefit from the RAM experience, is because everyone who has ever been on a global missionary trip or has ever been with RAM going into some of the areas that are the most impoverished areas in this country, you cannot leave that trip and come back home feeling the same way.
Absolutely.
You cannot.
Absolutely.
So from our point of view, with all the programs that I work with, I love the idea. I believe that, especially with our students, that it's our responsibility to make sure that they have enrichment, exposure, and experience in order for them to be able to still continue to have an obligation to work with folks that are underserved. And RAM does provide that. As a volunteer organization, you can't do everything. But I like to feel also that there will be a way to continue the collaborations with groups like the National Dental Association, but also to find a way to be able to build in some level of education or prevention into those programs in some way. I think, in addition to what Dr. Nicole said about making everyone aware of the importance that policy reform is, and making everyone aware that each person and coalitions of people can have a collective impact on changing policy and educating and informing the legislators. There are different things that can be done. Definitely, it has to be a multi-pronged approach.
You can't have a thriving nation without a healthy nation.
Correct.
It's so fundamental. Well, kind of looking at your personal experiences with RAM, my next question is, when you think of the work that you have done with RAM, is there one experience that stands out as particularly impactful and that kind of continues to your motivation to volunteer? Maybe a patient encounter or something you saw at a clinic. Obviously, throughout both of your careers, it sounds like you've had many things that have impacted and have spurred on that desire to continue and the passion for community service. But anything particularly from a RAM clinic? Dr. Harper, you want to go first? Or Dr. Cheek, go ahead.
I will. It's something that I see with every RAM event. It's the parking lot. It's the parking lot. Those parking lots are full, and we get there early. You know, we get there 6 a.m., 6:30 a.m., and we are arriving to a parking lot full of people. And it's full of people who are they are at some level of desperation, really, and they have reached such a level of need that they will sleep in their car in a parking lot
Mhm.
to be able to have a chance to have care. I'm sorry. But
Don't
that
apologize.
it's
Yeah.
not it's not just one time, it's every time. And that is the thing that hits me the most.
Mhm.
And that is definitely the thing that just keeps me just trying. Just keep
Mhm.
trying, keep trying.
Yeah. Thank
And
you.
I remember one time, and it was in Tennessee. I went two times, once in Tennessee and once in the Bahamas after Hurricane Dorian. But in Tennessee, I do remember a lady who had been in pain for so long and desperately wanted to make sure that she was one of those people in the parking lot that got a very early number. So I
Mhm.
don't know how long she had been in her car with her blanket and making sure that if she had to sleep in the car for a night or two, that she was there to get that early number. And I remember when the dentist, uh, I was there with a group, and I remember passing by as the dentist was talking to her, and she was just breaking down, crying. She was so happy. She hadn't been treated yet. She was so happy to be able to finally get there, and someone was going to see her, and someone was going to help her get out of pain. I'll never forget that. That just touches you in a way that you can never forget, the pain and suffering that some people are going through. The other occasion was after Hurricane Dorian, and the Bahamas was devastated. Some of those islands were just devastated, and people were trying to get to um, the main location where a dental clinic had been set up in a church. And I remember knowing that it was really the first time that RAM had set up a clinic collaborating with two other groups that on their own were also setting up clinics. It was the first time that RAM had to work physically on the site with two other groups. And I remember that it was creating a logistical challenge because it had never been done before. But I also remember how all three of those groups decided it was not about a competition. It was clearly about how they could collaborate and complement what each group was doing. And everything fell in line, and there were hundreds of people that had lost their homes, had lost everything, that were there trying to get seen. And those two experiences are things that get locked in to your heart, into your psyche. And when you realize that you're one small part of the solution, and you're working with an organization like RAM to just help, it's a very good feeling, and it's very meaningful. And you want to just see what more can be done.
And, and there's so many stories like that. It is such a privilege, I think, to be there and see folks who, at the very purest form, come in pain, and you get to take that pain away, and they leave without pain, and they're able then to resume their lives and go to work without pain and sleep and eat, like you were saying. And it's such a basic thing, and yet it's so monumental and so life-changing. Um, so what advice, I guess, would you give to either students in dental school or dentists who maybe have not yet volunteered with RAM? What would you tell them to prepare them for coming into their first RAM clinic? What kind of advice would you give?
Just go. First of all, absolutely go. Take advantage of the opportunity to be an incredible help to someone. And when you go, keep in mind that as many people as you're seeing there, because we know a RAM clinic can see upwards of over 900 people. And in fact, probably many more than that. The need extends beyond that. It's so much greater. So go learn everything that you can. Learn how to be very helpful, because it's one thing to go to a RAM clinic as, say, a dentist, and you go and you perform dental treatment and then you go on home. That's one thing. And as Dr. Harper said, even from that experience, you will be changed, but go and learn how they're doing what they're doing. Go and then be able to help set up the clinics in other places. Go and learn how to help other communities access RAM events and connect with RAM to invite them into their communities. Go and learn.
And then we know that a lot of the times health professionals are members of other organizations other than dental organizations. So if you happen to be a member of another social organization or a civic organization where you do know that your organization is definitely committed to health of the community, it's that organization or that group of organizations, that network of organizations that's going to be able to invite RAM to come into that community. So then it can never only be the dentist that is going to be the one that really drives that visit from RAM. It has to be a community-driven effort. It has to be where the network of community partners are collaborating to invite RAM to come in and agreeing to work together on something like that. I'm really, really proud of the program that the National Dental Association has, where it trains student leaders from multiple disciplines, and not only dentistry, to actually go to RAM clinics and to work with the RAM leaders to be able to have behind the scenes view, as Dr. Cheek was saying, about what really has to happen in order to put a RAM program together. And we also work with a huge organization called the Links. And the Links had a huge program not long ago in Prince George's County, the same county where little Diamante Driver died. And we were very fortunate to be able to take students behind the scenes so they could see how much preparation goes into hosting a RAM clinic, how many people are involved, how many volunteers are involved. And then I do have to say, RAM has opened up their doors and their headquarters, and we've brought students to the RAM headquarters as part of this training program to be able to actually work with the RAM leadership team. And as Dr. Cheek said, because the expectation is when these particular students that have been selected for this interprofessional student leadership program, these particular students are expected to be leaders, are expected to assume positions of leadership where they will need to know the resources that are required in order to put together programs such as RAM. But not only that, in order to be able to have the confidence and the knowledge to be able to educate and inform legislators that can help reform policy. So it's a great, great thing to be able to work with RAM in this kind of partnership that allows young people and all professionals as they volunteer to really feel like they are a part of something that's much, much bigger and very meaningful. And we hear it say all the time that you can be both. You can do good and you can do well and you can do good. So a lot of it, of course, I used to hear in my dental training that, in order to be able to give back, you have to have something to give back. which means that you have to be a good business owner. You have to be a good steward of your own finances. That's all true. The more you give, the more you get back.
Absolutely. And it's those ripples, you know, and the web of each one teach one.
Yeah.
And that I want to take a moment now and let our audience know if you do have a question and you would like to ask it yourselves. I was told that we can unmute you and you can ask the doctors yourself the question. It says they are discussing. What do we want to ask, Alex? Anyone?
So we have somebody in the chat that said, is there a way a primary care provider can support this organization? So Kit, how would you say that a primary care provider can support RAM?
Oh my goodness. Come and volunteer at a clinic. We can put you in touch with folks that we will find a clinic where you can come and provide service, and then tell all of your healthcare professional friends in your network, and we'll get everybody here. So absolutely, definitely come and be a part and join us in the mission to provide free quality healthcare to those in need. The more the merrier. Absolutely. Any other questions?
Oh, I'm so sorry to stop you, but if I could just touch on it really quickly. One of the other things that I think is so great about RAM clinics, we're dentists. We're talking so much about dentistry and dental care, but there are other services that are offered as well. RAM does offer medical services at these clinics, as well as optical services as well. We were talking about being able to go into a RAM clinic without being able to see and without having the ability to go and get glasses on your own, and walking out of that clinic with glasses. So I just wanted to touch on that really quickly before you move on to the next thing.
Absolutely, the interdisciplinary aspect of it, and really being able to see all of that, just the overall improvement. It looks like Julia. Welcome, Julia. Do you have a question for Dr. Harper and Dr. Cheek?
There you are, Julie. You can unmute now.
Uh-oh, can't hear you.
Maybe Julia can put it in the chat there. Is there anybody else that has a question?
So we have a couple questions in the chat. So this one is directed towards you, Dr. Cheek. So Dr. Cheek, you touched on refining health policies earlier. How do you recommend we advocate and push for policies to decrease health disparities?
You know, it's so funny. I've heard it so many times, and especially when I was younger, I was like, what are these old people even talking about? But write your congressman, write the people that represent you, write letters, send emails, make phone calls to your state legislators, write and send letters and send emails and make phone calls to your city council people. They are the people who are supposed to be representing you. And so your issues are to be their issues. So it is not new. There's no secret to it. That is still the biggest part of the answer, and let them know that these are the things that are concerning their constituents.
They work for us.
Exactly.
Definitely, you have to be registered to vote in their district.
Yes.
In order to be able to get their attention.
And we have another question. It says, which NDA program sends students to see a behind-the-scenes view of how RAM clinics come together?
It's the program that's called the Interprofessional Student Leaders Program. And it's based on recommendations from our 10 academic partners, where we have deans and faculty from those schools, 9 different disciplines: dentistry, medicine, nursing, pharmacy, law, social work, business, public policy, public health. We have at least 9 schools now, academic schools, that are involved in this program, and students can participate in this program by being selected and recommended by the deans.
And if I could just say really quickly, and I hope I don't embarrass him, but I couldn't help but notice one of the little bubbles that's over to the right of my screen. One of the alumni of our Interprofessional Student Leaders Program, Logan Kraft, I see his name there. So I just had to take a moment, because I do think that this is definitely one of those situations where the students came, they were changed, and he's one of the change agents that's out there now, making the world a better place. So thank you,
He
Logan.
works for RAM.
Yes, he does.
We know.
We are so proud. Logan, sorry, don't mean to embarrass you, but we're proud.
We love Logan. Absolutely. Wonderful. Let me see if Alex has any other questions. What dental schools participate in that program?
Howard University, Meharry University, Columbia University,
Harvard
University. I'm blocking on all of the other dental schools that we had, at least 5. And then University of Tennessee has the hygiene program. And then those are the only ones I can think of right now. I apologize. I'm blocking on all of the schools.
No worries. We put you on the spot.
Yes, but I love it. I love it.
Hello. I think my audio is working now.
Yeah.
Thank you for your patience. So I am a DNP student at Duke University. I've heard of RAM through my undergrad at Radford University in Southwestern Virginia. There were a couple of those, especially the dental clinics that would go out there in Southwest Virginia. So I am doing a DNP project, and we're going to Honduras this spring. And I'm interested in doing a project on like the readiness of people doing medical outreach, so for us, it's PT/OT, medical student, School of Nursing. And then I wanted to translate that to other remote areas. So I was wondering if you guys had any contacts for me. This is my first meeting. I just sort of got the link. So I loved hearing about pediatric dentistry, and health equity, I think, is really important too. So just wondering if you guys know, other than just like the website, if you have any people who I might be able to get in touch with.
Julia, we could definitely get your contact information and kind of put you in contact with folks if you want to send your maybe email address or something like that, and we can kind of work that way.
Sounds great. Thank you.
Thank you, Julia. Thank you for the work you're doing in the research.
Yeah, that's great. And one of the things also is that we're focused in National Dental Association is focusing on training nurses to be able to have higher levels of competency in doing oral screenings and in also doing oral counseling, oral hygiene demonstrations, and being able to just make doing an oral examination or oral screening a part of their basic routine screening. That would really, truly help in all of the areas that you're talking about.
Wonderful. Well, looks like we're starting to come to the end of our time. Dr. Nicole Cheek, Dr. Hazel Harper, thank you both so much, not only for sharing this evening, being our first guest on the inaugural webinar series here, but sharing your heart and your passion for the dental field and volunteerism, and sharing in our mission and making that a part of your mission as well, and what you do for RAM and for the communities that we serve. Thank you so very much. Any last parting words, I guess?
I'm going to go now so that Dr. Cheek can have the very last word, but I just want to congratulate RAM on hosting this program. I hope that it's the first of many, many, and I just think that it's a wonderful way to really let your audience know all of the good things that are being done and all of the folks that are helping to make RAM even better than it is already. So thank you for inviting me.
Well, it is y'all that are making RAM better. So thank you so much. Dr. Cheek?
Oh, that's so lovely. Just two things that I would want to say. One, it is definitely Children's National Dental Health Month, but February is also Black History Month. And so for the National Dental Association, that is African American oral health professionals, this is a very special month for us. So definitely wanted to thank you, not only for helping us to celebrate Children's Mental Health Month, but also having us here, and wanted to just take a moment to say that even though we are African American oral health professionals, our mission is really all underserved populations, everyone that needs help. That is who we serve. And also wanted to just say that as the president this year, my theme for the year is standing on the shoulders of giants and launching into a future beyond imagination. And I just wanted to take a moment to thank the giant that I was honored to speak and present with today, Dr. Hazel Harper. And also thank you for making this about the children who will be the ones to carry us into that future that will be beyond all of our imaginations. So thank you, Kit. Thank you, Ram.
Thank you both so very much. I want to say a very special thank you to Alex Phipps, our social media specialist, who put this on, and Chris Cannon, our marketing manager, who was making sure we were all being heard and seen and whatnot, and the wonderful job that they are doing. And I'm excited to be a part of this web series, and we're excited to move forward. Definitely, I think we're going to try and do it on a monthly basis. So everybody stay tuned and be watching your social media. So and we'll let you know what the theme is going to be next month. But again, thank you so very much. We are delighted and honored to have had you. Thank you all for being a part of this, and have a wonderful rest of your evening.
Thank you.
Good night.
Thank you.
Thank
Good night.
you.
Good night.